Services, Matthew Budd. Welcome back.
Thanks for having me.
Yeah, good morning, Matthew.
Good morning.
Oh, it's like COVID's back.
No,
Fortunately, we're doing okay on that front today.
You know what's interesting is you shared a percentage. 93% of our students in Jackson County are up to date on vaccines.
Yeah, well, I think it's a good time to talk about
Yeah.
vaccines. We're going back to schools. August for us really means back to school vaccination,
Yeah.
right? So I think one thing people don't realize is that our schools in Jackson are incredible.
Right.
And really we're top 3 last year in regards to vaccinations and reporting on vaccinations. We do a really good job in Jackson County, and it's our schools that are really to thank for that. And my team, I'll thank them too, because they follow up and do a lot of work.
Yeah.
But yeah, 93% of our families, and children are enrolling in kindergarten, 7th grade, they're up to date on their vaccines.
That's interesting too. So that's the third best rate in the state.
Third best reporting rate. We do a really good job with that state compliance and things like that, but we are still over that top half, and I think top quarter in regards to vaccination. One thing that, talking with our IMS team, we did really well in COVID, and you heard of vaccine hesitancy, and that exists, and we are seeing more vaccine hesitancy here in the community. But I think looking at our rates, we've done a lot to kind of encourage vaccines. We're working with community leaders, with schools, and I don't think our rates have slipped as much as they have in other places.
Good to hear.
But we're hearing measles, which was a disease that was eradicated for all intents and purposes, is back.
Right.
And it's pretty significant.
It is, and I think we've seen a lot of cases this year. And so measles was declared eradicated in the U.S. In 2000. But we've seen several cases since, and we've had years before the last couple where we've had measles cases, but we've really had a huge outbreak in Texas and some of the surrounding states. And we've had, last I heard, I think we're above 15 measles cases in Michigan now. And this could mean, of course, that we could see more cases in Michigan. And we talked a lot with our schools, of course, in the spring about recognizing measles and what schools should do if they think that they have a suspicious rash or a case in their schools.
So going back to school, and I know this is where disease spreads, and that's where we see the rates rise when school's in session. Besides measles, what are the other concerns do you have?
Yeah, I think the other thing that we saw a lot of last year was pertussis. So that's another respiratory virus, of course. So as we move into the fall and winter, yes, COVID will come back in our schools, flu will come back, pneumonia, RSV. Pertussis, I hope, is one that doesn't come back. It's a vaccine preventable disease, much like those others, but it's really detrimental, especially for those young kids. And so pertussis is also known as whooping cough, and it has a really distinct cough, and coughing fits so severe it can crack ribs.
Really?
So it can be really dangerous for not only young kids, but older adults too.
Anyone can get that.
Yeah.
And it's like all these diseases are easily transmissible.
Right. Yeah, and some of these diseases like measles especially, if you're in a room full of unvaccinated people, everyone is very, very likely to get measles. And what really helps us is, vaccinated people are a lot less likely to get those diseases, right? It's like 97% effective if you're up to date, meaning the chances of getting sick from any of these vaccine preventable diseases are much, much reduced.
Have you heard of these things called measles parties? Where
Chickenpox parties.
Is it chickenpox
Well,
parties?
that's, I think, what it used to be called.
Right, yeah. I was just a few years shy of being able to get the chickenpox virus. So,
I have it.
Yeah,
It was glorious. Remember?
Well, people they'd expose all their family or all their kids or all their neighbors to the measles so that they would be immune in the future, but it's too dangerous a disease.
It is. I think, there used to be the idea, let's get it away, out of the way. And what people, and a lot of the times, and I will say a lot of the times people are okay, but it's those times where people aren't. Up to about 20% of children with measles get hospitalized that are unvaccinated. So it's really, it can have a big, long health effects. And for measles and pertussis, both, they can cause swelling on the brain, seizures, and there is that chance of death.
And you're encouraging, of course, all who's eligible to come get vaccines before school. You have your immunization clinic hours.
Yeah, come see us Tuesdays, Thursdays, Fridays, but give us a call this year. We expect to be really busy. Call us, make an appointment. That way we can make sure we can see you in the time. And new this year, we've always been a Medicaid clinic or a clinic that we can provide vaccines to the uninsured, but now we can take Blue Cross Blue Shield,
Okay.
Priority Health, and Blue Care Network.
Okay. I was going to ask, what do you do if you don't have insurance or a primary provider? Can you still?
Yes, we
Yeah.
should be able to get you covered. That's why that phone call might be helpful
Absolutely.
too, just to make sure.
And 25% of Jackson County are on Medicaid. So that's something you continue to do. And this population now, obviously, you continue to serve. And the cost, I think we saw there was some announcements throughout the year that the government was going to stop paying for certain immunizations, including the COVID vaccines.
Sure.
Are people, where are we on the do we know what vaccines we're supposed to get for COVID, and is it a recommendation?
So there are recommendations still for COVID, and more will come in the fall, especially as those start circulating. So I'm kind of waiting to see what happens right now. Individuals 65 and older still recommended to have had a dose, and who knows if we'll get a new booster or something like that for the fall too. I know the American Medical Association and American Pediatric Association still encourages younger individuals to talk to their providers and are recommending those vaccines.
And the health department is here to literally answer all of your questions, so you can call Matthew.
Yeah, call me, call my team, and I really recommend talking to your provider, especially if you have questions, concerns. A lot of people in the community are on, delayed schedules. I understand why people might want to delay, and so if you're delayed, it's important really to talk to the healthcare provider, see what's coming up next, because those schedules get really complicated when they get out of sync with kind of the recommendations, because some like live viruses and things like that, you don't want to give with other vaccines. So it's really important to work with the healthcare provider.
Yeah, and people that are sending their kids to school for the very first time, the young fives, preschool, kindergarten, there are requirements that you have to meet in terms of vaccinations. Now you can get waivers, but there's still requirements, right?
Yeah.
And we do have information on our webpage, and of course the state health department does, in regards to what those required vaccines are. And we're here to help people get up to date with them.
Great, thanks for being here today. From the Jackson County Health Department, Deputy Health Officer Matthew Budd. More of the morning show after this.